Let me mention one more bonus. So
Please.
CRP was my 6th bonus. That was my number 6. my number 7 bonus, which we'll love to talk about this, is actually testosterone levels. Testosterone levels for both men and women of a certain age. Yep, it's a bonus. It's easy to check. It's not expensive. It's not a send out lab, and very actionable, right? So obviously for guys, here's the bad news. There's an aging process going on that affects our testicles. Okay. And I was reading about this, and it's like, so sometimes you know too much, right, Shawn? And it kind of like, it's like the weight of the world hits you, I go, oh my God. I found out that, one testosterone producing cell in our testicles goes offline every 4 seconds. Okay. It dies.
Oh my gosh. Every 4 seconds.
That's the pathology, Shawn. Yes. Every 4 seconds, one Leydig cell is going offline. Aging process. I mean, yeah, not fair. So thankfully, we've got quite an amount of these things, but that's the fact of it. And so at some point that catches up to you. So short answer is, guys, if you're over age 30, let's just say, and starting to feel anything possibly symptomatic of low testosterone, like fatigue, lack of stamina, slow loss of muscle mass, gaining a little belly, lack of sex drive, poor erectile function, depression, listlessness, get your testosterone level checked. Something can be done about it. The quality of life change can be amazing. Revolutionary, game changer. Those are fair words to describe it. And as well as women of a certain age, especially I would say driven by the symptom of low sex drive, a little bit of testosterone can do wonders. Men and women both need it, just like men and women both need estrogen, obviously different ratios. But Shawn, why don't you comment a little bit on that? That would be my last bonus.
Yeah, I would love to. So honestly, outside of vitamin D, I think testosterone is probably the most important lab. Now, here's one of the things about vitamin D. I'm just backing up a little bit.
Mm-hmm.
I think optimal levels of vitamin D are the most important thing. And I will tell you from experience of thousands of patients, as you kind of mentioned, most patients in our area need 5 to 10,000 units a day. So if for whatever reason you didn't want to get checked, if you take 5 to 10,000 units a day, you're going to be in probably the optimal range for most people. So, but as far as testosterone, it's all over the board. So you do need to get testosterone checked. I think it's probably, outside of vitamin D, probably the second most important lab to get checked. I'm quoting Dr. Neil Rosier.
Yeah.
What if we had a drug that worked to help maintain lean body mass, burn fat, including visceral fat, decrease insulin resistance, increase libido, decrease depression, decrease erectile dysfunction, increase bone mass. The list goes on and on. What if we had a drug like that? Well, we do. It's called testosterone. And like you say, men and women both benefit from it, just in different amounts. So very, very important, especially for any man over 35 or 40 years old. And I would say, just like you were saying, even if you don't have symptoms yet and you're in your 30s, it's a good idea to get it checked in your 30s. And here's the reason why. Let's say, and I've seen this before, let's say you're in your 30s and you have never ever supplemented with exogenous testosterone before. You get your level checked and it's 1,200. I've seen this happen. And normal testosterone levels are 250 to 800 depending on the lab. So when you're in your 30s and you're having no symptoms and your level's 1,200, then all of a sudden you're 45 years old and you're having symptoms, you're feeling a little bit sluggish, you're not as competitive anymore, you maybe have some erectile dysfunction, weight gain around the middle, high cholesterol, and you go in to get your testosterone checked. It's like, well, doctor tells you, of course you wouldn't tell him this, Dr. Turner, well, your level's 450. I guess you're normal. It's like, well, wait a minute. When I was 30 and I didn't have any symptoms, my level was 1,200. And I felt optimal. So, I want to be optimal again. So comment on that, Dr. Turner.
Great point. I mean, nothing really more to be added to that. It's a great point. This is where finesse and clinical judgment and acumen comes in, right? You can't just treat a number. You have to talk to the patient, figure out what they're telling you, and put that together. And I mean, I see this all the time. The most typical I would see is somebody comes in maybe with a level like 300 or 400s. The primary care told them it's fine. It's not high enough. or low enough to do anything about. And I go, well, tell me how you're feeling. And they mentioned a few symptoms. And I go, I guarantee you, if we took this thing to 800 or 1,000 or 1,200, all those symptoms will disappear. You'll feel like a new man. They go, seriously? I go, yeah, it's not even complicated. I guarantee it. They come back in a month. They're feeling like a champ. You know, they're not drinking Red Bulls trying to stay awake. They're back in the gym. You know, they're out, they're getting chores done. The honey to-do list is happening. You know, the wife's just thrilled. They got, you know, fresh enthusiasm in the bedroom. All kinds of things turn around because we decided that 400 like actually isn't a great number, you know, for them.
Right. And this is, I tell you, especially after going to a Dr. Rosier conference, it's just, you know, reiterated over and over again. So Janet's on the same page. It's just like, you know, we are so used to in medicine to just waiting until people get sick. And so that same testosterone patient that, you know, has a level of 300, he is just setting himself up for a heart attack if he does not replace his testosterone.
Yes.
That's a whole topic for another discussion because, you know, we know testosterone does not cause heart attacks, but we have to defend ourselves about that sometimes. But that guy is setting himself up for many different disease states, including sleep apnea, including cardiovascular disease, including dementia. So let's not wait until those problems happen. Let's be proactive and stop this from happening. And that's what I love about you, Dr. Turner, is that you are good about taking care of patients and keeping them healthy.